So today, what we are going to do, based on 6 stages of pathogenesis of Ayurveda, we are going to evaluate 2 persons here. They have some cellulite, and these 6 stages are: first stage is accumulation stage, and then toxic built up or doshas, vata pitta kapha, different kind of vata pitta kapha can accumulate in any parts of the body. That's the first stage, called accumulation stage. The second stage is, first sanchaya means accumulation. Second stage is prakopa, where you can see accumulation, you can see as aggravation, when really the cellulite forms. That's the, according to Ayurveda, stage 2, but that's when you can see visibility of any conditions. So that we will evaluate first. So let us see in this subject, in this divine lady, where cellulite is. So first let us see the cellulite, just the stage 1. Where is the cellulite? Can you tap
So
it?
we can see here that there's some visible cellulite going on.
Yes, some visible cellulite going on there. So let us see where, if it is stage 2, just stage 2, not gone to other stage 3, then what you can see them, but when you palpate them, they can disappear easily. This is looks like gone beyond that, no?
Yes.
This is gone beyond that. So if you see cellulite in any other, like here, some stage 2 here, but here it is gone stage 3. See, the stage 3 is sanchay, prakop, pressure. When from one place to other places, getting there, from one place, accumulated in one place, get aggravated in one place, then multiple, you see the multiple places are occupied by the cellulite. That is pressure, called pressure. And then what happens when pressure is, means you see the multiplication from one place to other places, maybe inside also. And then the fourth stage is really called asthana sansraya stage, when localization happens. So in localization, they are really very visible, and they, if you, like here, you see, in the pinch test, the second one is easy to pinch, second stage, but third stage is little difficult to pinch, and fourth stage is also, you can see here, it's pinchable, but it is, I can tell you, this is fourth.
I think it's fifth.
Fifth? Beyond bound, you say?
She was beyond bound, but we've been working a little bit, and it's starting to soften a little.
Yeah, this is like in between fourth and fifth, I can say, because you are treating her.
Yes.
So really the first stage, you don't, it's just accumulation anywhere in the body. Second stage, I don't see here, because second stage you can see it, but if you push or rub, it can get vanished, very easy. The second stage is very easy to treat, no problem, with my protocol, even in 3 weeks, don't have to go to 7 weeks. I have a 7-week program for stage 4, up to stage 4. But if it is a second stage, even third stage, within 4 or 5 weeks, you will see the significant change.
The skin on second stage will be like this.
Like, yeah, you can pinch it like this.
You can pull it away from
pull
the
it
body.
away, yeah. Still there will be bump, but if you do the pinch test, it is going to be like this. Second stage. Third stage, little bigger pinch. Fourth stage, bigger pinch but stiffness, with stiffness. Fifth stage, you can't pinch.
And she actually has stage 5 on the back, if you want to show the back.
Yeah, show the back, yeah.
So if you can't pinch anything.
Yeah, yes. Oh, yes. This is stage 5. This is stage 5. So the first you can see, second easy to pinch, third pinch but thicker pinch, and fourth pinch very thick but harder. No, if you tap you can't do anything. So here I can tell you it is beyond bound, means what it is, fifth stage, but still the softness is there. So usually we don't take fifth stage, but in her case, because not that hard. See, pinch taste is one thing, but it is soft. So
liability.
You can palpate them. So it means, both are like this is more softer. So it is between fourth and fifth stage, you can say, and we will scan her in next session, and then we will start treating her, and every week we will evaluate her that how much it is melting down, and what you should do in her case, measure her also. Measure her, that will help it how much total body fat she lost, and how much muscle is getting better. So, and then also local. So tapping, pinching and rubbing, you do this. This is between fourth and fifth. When the fifth stage is harder, then it is really difficult to manage, because you still see you can see the softness is there, and also, so this is between fourth and fifth. So always you have to see in the borderline there. So if this is like this, you can take the case and can put on our protocol.
And also, as you notice with Paula, she has a couple of different kinds. So she's got like between 4 and 5 on the front. She has 5 here, and I find that on various patients that they have multiple levels going on in different areas.
So what you can do in that situation, you can tell your client that, see, this is this, and you will see change in this. But this, you will try, but no change. But whenever stage fifth is there, beyond bound, you can't even pinch, and very hard, don't take that case. Because who knows what is hidden there. And always ask about whether they are insulin dependent, diabetic, or any other reason, cancer anywhere in the body.
I know cancer would be contraindicated, but would diabetes be contraindicated for
Diabetes
treatment?
also, what happens if somebody has insulin resistant diabetes, it is very difficult to take care of any kind of inflammation. See, in my teaching, I'm going to tell everybody that how the inflammatory toxins are accumulating, how the nerve fibers, nerve fascia is getting tortured by toxins. In that kind of situation, wherever you're having free radical and this kind of stiffness and pain sometimes, then you have to be really careful. And insulin resistance, what happens that they cannot control the diabetes. Yes, that's what happens. Even they are on insulin, they cannot control the diabetes. Whenever a lot of sugar accumulation is there, healing and regeneration is totally out of question. Very slow. Inflammation goes high, healing, and then when you will start treating, you will try to open the channels, and then you want to take out the toxins. But after that, healing and regeneration will not there because of the all the time high sugar level. So that is going to create complication for you. Yes, there is a liability issue, or your name and fame will be ruined. So be very careful. Always ask about 2 things: diabetes and cancer history.
That makes sense.
Anywhere in the body. Yes, because body has cancer, and these are very inflammatory toxins sitting there. We'll talk in the theoretical course. So you have to be very careful. Okay.
Wonderful. Thank you.
So this is another subject, and we are checking. This is beyond bound stage. But the same thing is the stage between 4 and 5, because
has give.
she has a soft the muscle tissue, fat tissue is not hardened. So we will consider that we'll take her and start treating her, and every week we will evaluate. It is between stage 4 and 5. Can you turn a little bit? Don't fall.
Do you want help?
And let us check here.
Stage 5.
Yeah, it is harder than front.
Yeah.
So it is stage 5, but we'll try. We'll see how my protocol works on stage 5.
And
So-
still soft.
But yeah, this is more harder and this is softer. So we'll see. We're really able to see during 7-week time that how my protocol is helping. I'm hoping in this we'll get more help, and this it may take more time than 7 week, because I can see little micro calcification there. We have program for that also, but this one is softer.
And that
So-
feels like hard spots.
Hard
Right.
spots, some micro
The calcification,
calcification there.
yeah.
Yeah.
Right
So this is between 4 and 5, but this is certainly 5. I know it is. Yeah, it is 5. It is between 4 and 5. So we will keep doing it for more people. One more subject. There will be 3 subjects, and we will keep treating them every week, and taking pictures. Maybe little small videos of them. It will be good for teaching, and we really see how the protocol is working. I'm very sure that with complete protocol, we'll scan these people, why they got it, among 25, 30 or 40, etiological factor, and then we'll check on that etiological factor, try to stop them, and they will have etiological factor based protocol. That's the beauty of this Cellulite program. Nobody has it. That's why we are really sure that this is going to help in up to stage 4. It is going to help for sure. After 4, it is becoming little iffy, but we'll try anyway. We'll see how it works.
Because she's a stage 5, so that's not the very worst stage, right? The very worst stage is the stage 6.
No, two
Right.
things. She is stage 5, but she doesn't have diabetes.
Okay.
She doesn't have any history of cancer. So even though it is stage 5, we will take her. Yes?
Right.
And we'll try, because see, complication during detox can happen if somebody has insulin resistance, diabetes, and any history of cancer, present or past. Yes? But she is beyond those things. She doesn't have these things. So we will try, and it should work.
Okay.
We will try, it should work. And we will see.
Okay.
Yes?
Great.
Wonderful. Nice test. Thank you. Thank you, everybody. Namaste.